So why don't we get started? So as I just said, welcome everyone, and maybe for the people that may be with us watching, tuning into the meeting, we can start with introductions. And Pat, I will start with you, Madam Chair, and then I'll work around the screen.
All right, my name is Pat Kimball, and I'm the current chair of the Maine Recovery Council, and welcome. I apologize, I am sick, so I cough all the time, so I apologize as I cough in between everything in advance.
Oh, no. Todd.
Good afternoon, everybody. My name is Todd Brackett. I'm the sheriff in Lincoln County.
Excellent. Liz.
Hi, I'm Liz Blackwell-Moore, the Director of Public Health for Cumberland County Public Health Department.
Great. Kim.
Kim Johnson, I'm a consultant.
Excellent. Gordon.
Gordon Smith, I'm the state's director of opioid response in Governor Mills' office.
Excellent. Ella.
Hi, my name is Ella Capin. I'm a research assistant with the Office of the AG.
Kina.
Hey, Hina Thakrar, infectious disease and addiction medicine doc in Portland.
Excellent. Courtney.
Hi, everybody. My name is Courtney Gary Allen. I'm the organizing director of the Maine Recovery Advocacy Project and a person with living experience of substance use.
Chastity.
Hi, everyone. Chastity Toole. I'm the Northern Director of Harm Reduction Services at Maine Access Points.
And Brendan, I'm not sure if you're listening or, oh, there we go.
Hi, sorry, it's Brendan O'Neill, Assistant Attorney General in the Attorney General's office.
Great. And Haley.
Hi, sorry, I just got the call that I've been accepted to law school, so I'm very excited. I'm Haley Drago with the Attorney General's office.
Yay, congrats, Haley. That's
Thank
so
you.
good.
I'm so excited.
What a great Christmas present.
What a great gift for all of us.
Congratulations.
Thank you.
That's awesome. Congrats. And I'm Joe Everett, the president and CEO of the Opportunity Alliance and the chair of this committee. So welcome, everyone. So as I mentioned, because it's the next special meeting, we'll forego the minutes this time, and then next month we'll do both sets of minutes. And just sort of to recap where I think we are today. So Pat, I'm not sure, or anyone from the finance committee, if there's any updates from Ben or anything we want to say from the finance committee as it relates to our work. I know Ella's put together a bit of a framework around procurement, so we're going to start off with that. And then we can go from that into our priority conversation. And Mary put together, and others, a document that can drive that. And I can, once we get to that section, we can recap sort of where we landed, where I think we landed in the four areas and what Mary has documented. So any other business besides those items, which are pretty lots of ground to cover? So anything, Pat, or others from the finance committee that you want to, that should ground us as we start?
So I first will apologize because I was looking for it today, and I just had emailed Ben, hoping I caught him before he left on vacation. So the finance committee did meet, and Ben, the treasurer, laid out 3 or 4 scenarios of how the money would be spread out over 18 or 20 years. And we have a recommendation that we're going to bring to the committee tomorrow for them to look at as to how that money is. I went to look for the spreadsheet.
I have it, Pat, if that is helpful.
You can find it?
Yeah, I have it up if you want.
Yeah, and we determined how the finance committee thought would be our recommendation as to how that funding would be laid out. But I looked everywhere, I couldn't find it.
Courtney, can you give us the highlights since you have it up? It might help around our...
I'm happy to do that. The recommendation from the finance committee will be that to combine kind of the different examples that we were talking about. And so in year 3, which is the year that we're technically in right now, we will be recommending total spending of $15 million. Year 4, which is 2025, 15 million, and then it goes down over the course of those years. If somebody wants to give me screen share, I'm happy to share the screen share spreadsheet if that's helpful. So 15 million for the next 2 years.
And any other guidance around the categories, Courtney or Pat or just that's the amount we're working with?
No, the finance committee did not talk about like separating that. That's the total amount of money that the council, the recommendation to the council to spend each year. That includes the 3% to schools, any administrative fees, Mary's position, etc.
So you have
Uh,
to read
10 million of it is ongoing and 5 million is one-time or short-term funding.
Okay, great. Well, that's helpful. Any questions or any comments to add to that? So Ella, why don't we turn it over to you and you can share your presentation with us.
Okay, great. I'll go ahead and start sharing now. Oh, I think I need permission to share. I'm not sure who would grant me permission.
I just made you a co-host. You should be
Oh,
able
okay.
to now.
Okay, thank you. Okay. Can everyone see my screen?
Yes, yeah.
Okay, great. So as we're beginning our discussions of the priorities and trying to get this funding out as soon as possible, I went ahead and put together a very basic grant application overview after having a few discussions with Mary and with other people, and also after looking at some precedent grant applications. So I just wrote those reference materials right here, but basically I took a look at Virginia Opioid Abatement Authority's application for what they're doing with their grants and their funding, Efficiency Maine's Program Opportunity Notice, and the state of Maine's Department of Health and Human Services Office of Behavioral Health Recovery Support Centers RFP. And so I looked at all of those applications as examples, and I sort of distilled them into this 11-page, very high-level overview of what a grant application for the state of Maine could look like. And so I just sort of wanted to walk you all through this in a basic way, just to show you, to help guide the conversation as you all are thinking about priorities and getting this funding out. And help us focus on some more specific details before we go ahead and continue with next steps in this process. So there are a few categories, or not categories, but sections in the applications that I noticed, and I wrote them here in this index. So this particular application contains 8 sections, and that would be information and instructions with some context and background on where these funds are coming from, and what the state of Maine is looking for in terms of funding, eligibility for the applicants, application requirements. So this might include like a budget or a timeline that an applicant might need to submit along with their application, amendment process if an applicant wants to amend or renew their application. This is something that you might also want to think about, is allowing an amendment process to be developed as well. Evaluation criteria. Virginia, for example, I believe it's Virginia, has a rubric. And I think that could be helpful in terms of transparency and standardizing how we're going to, or you are going to evaluate these applications. So there's a section on that, and then a request for reconsideration and appeal process. And then the reporting and legal agreements. And in the legal agreements section, I took a look at the council's conflict of interest policy and the financial disclosure statement, and I sort of folded that into this as it applies to this application. So those are all the sections, just on a broad level, for you all to consider as you think about this, as we get more specific in this process. And I also just want to note that I wrote this application with the idea that it is all inclusive. So for example, if you want to put out an application that's for one-time payments, versus ongoing payments, or if you want to put out an application that's funding something from the ground up versus supplementing something that's already been established. I can fold in those details as we make this less of a skeleton, more of a specific application. And so it's very broad. And of course, all of this is a draft and it's subject to change and none of it is official. I just wanted to sort of put this out there so we can start to think about things. And I will send you this skeleton along with the referenced materials that I used to put this together in an email after this meeting so that you all can take a closer look. There's a bit of legal jargon in this application and you don't need to worry about it just because that can be fixed later, but I don't mean to overwhelm, I just mean to lay it all out. So as you can see, I put in the comments or in the margins, some comments of things for us to think about. So for one example that Virginia does that I think we might be interested in is the gold standard incentive program, which provides a 25% increase on the applicant's program's allocation, provided that they agree to apply to the gold standard, which just abides by certain rules and regulations for their distributions and how they use the funds. As you can see, Brendan wrote here, this refers to an incentive program created by the Virginia Abatement Authority. We introduce it here as a concept to highlight something the council may be interested while being mindful that you all may want to incentivize other things. But that is something that we could incorporate in this grant application. Another thing to note about the gold standard incentive program is it could also just be a way that we simplify how we gather reporting requirements. I don't know, Mayor, if you want to say anything about that, but we could incentivize how people, or to what extent people report, so that I'm not sure if I'm describing this 100% correctly, but
yeah, you got the gist of it. So the gold standard incentive, I think, provides a good example for us in terms of a way we can help incentivize reporting for organizations receiving grant money without putting, a heavy burden on the applicants in terms of what information we're going to ask them for at the end of a grant cycle or every year. So it just incentivizes, that data collection process for us, again, while trying to streamline the requirements that we're putting on or asking of the grantees.
right. Thank you. So another thing that you all will want to think about is the technical assistance portion of this grant application process. You all need to think about who the contact person is going to be. I know that Virginia, for example, offers assistance for applicants who want to reapply if they were recommended for denial. And I'm not sure to what extent you all will want to have a system like that, which will of course require, more resources, more time, a little bit more money. But that's definitely something to think about in terms of ease of accessibility for applicants, is having this technical assistance portion. Okay, and then the rest, I don't think I need to go into great detail with the rest of these sections, although one other thing to note is that Virginia, for example, has these attachments that go with their application. So they have like a budget workbook, a project timeline workbook, etc. And that is something that Maine could have as well, just to make it a little bit easier when it comes to review time, is have these other attachments to supplement the application so that it's very clear how people plan to spend the money and on what timeline all this is going to take place. Yes, so that is everything in terms of this application, which again, I will send you, and feel free to let me know of any questions or any concerns. Yes, Brendan. Oh, I can't hear you.
Thanks, Ella, and thanks, Mary. Let me just ask, just to make sure, sort of I, kind of understand this correctly. I'm sort of understanding this to be something that, the council members, I think I would encourage the committee to not get particularly hung up at this point on anything that's either in or not in this document at this time. It's not meant to be sort of like, here's what you have to work with. It's more, as I understand this document, and this is where I'm asking Ella and Mary to confirm this. It's meant to be sort of a high level introduction of the concepts of an application, using as kind of a baseline, or not using as a resource, the three sort of documents that Ella opened with, which are, what's another state doing? We look at Virginia. It's got a model that a lot of people have looked to for for thoroughness and its process. We have the DHHS application process, which many of you are familiar with, and we have an efficiency Maine application to look at for how things are done with a sort of quasi state entity here in Maine, that has somewhat different flexibility than the executive branch may have. And so these are, as I understand it, Ella and Mary, this is sort of meant to kind of help the committee start thinking about, in your roles as grant makers or grant recipients or application writers, things like that, what are the kinds of things that the council will need to start to want to see in an application, and some potential concepts like a gold standard and what that ought to incentivize, and things like that. Is that about right?
Yeah, that's 100% correct. And apologies for not making that clear enough earlier, but this is by no means something that you will have to abide by. It's just to serve as sort of somewhere to start, in terms of thinking about next steps and details. And as I've gone through and put this document together, I've also come up with a few questions, and that brings me to this next document, which is just considerations, or I won't go there quite yet, but it's just considerations for you all. Yes, Gordon. Oh, you're on mute.
Yeah, thanks. Simple question. Are we required by anything to, in fact, have a process for reconsideration and or appeal?
Brendan might know, but I would say that the other applications that I've looked at do have these processes, but I don't know that it's required.
Gordon, an answer is that, there's nothing, and I think this, specifically described in the MOU or the statute that requires there to be like anything about the process. The council's got a lot of discretion about, how it's going to give out the money. Nonetheless, I may advise the council that it would be, in its interest to have, some kind of appeal process, to carry out some, to ensure there's sort of due process, in the distribution of these monies. I'm not there yet. I don't have a conclusive answer, but I have sort of kicked around the issue.
Okay, that's the answer that I was looking for. Thank you.
Yes, Dr. Johnson.
Just also, not everything has to go out to bid, right? So there are other ways of distributing the money. So this would be just for the things that are going out to bid? That's a question.
Yes.
Yes. The other point I would make is, we don't want to take time in this meeting, honestly. There'll be another opportunity to discuss it, but I think by having such a process, it sometimes just invites appeals and reconsiderations that are a complete waste of time. And now I could be convinced that for fairness purposes, we have to do something like this, but I can I can tell you that I will be arguing for a fairly high threshold.
Sure.
You know, show me something, you know, that rather than simply saying, well, you know, take another look at the same thing we just submitted. So I'm just leave you with those thoughts. It's not the time or the place to debate all that right now.
Right. Thank you. So this is a list of considerations that I've put together that I will send you in the email with all the rest of the materials later. I am not sure how you all want to respond to this. As Gordon just said, now is not the time, I don't think, because these questions require a lot of thought. But they are questions that Mary and I would like to get an idea of what you all think before we continue with the next steps of this process. So like, as I was writing that document, these were things that came to mind that I can't answer, but that the committee and the council would need to answer in order for us to continue. The first main question that I would just like to put out there is your thoughts on a contractor for this grant application process. I think that's definitely something that needs to be determined. But
Hey, Ella, sorry to interrupt you. I can only see the skeleton, and I know there's a page. Yeah, you wouldn't mind just pulling that up so we can follow along.
Yes, yeah, thank you.
Yeah.
Okay, here's the considerations. Can you all see?
Yes.
Okay, okay, great. So this is the document that I will be sending you in addition with all the materials that I just mentioned and the grant skeleton. And these are considerations. So I'm not sure how you all would like to compile your responses. I don't know if we'd want to do another sort of spreadsheet eventually down the line of, for example, how you all vote on how each of these procedural questions should go. But basically the primary question I have is regarding your decision to hire a contractor for this grant application process, just something to think about. But that is everything from me today. I'm happy to answer any other questions or concerns. Yes, Courtney.
Excuse me. I guess I was just curious, this is for if we are putting out priorities and they would be responding to that?
It doesn't
organizational. Yeah.
Right. So, I mean, Brendan, correct me if I'm wrong, but my understanding is that it doesn't necessarily have to be for that. It could just be any sort of funding that you would like to put out and see how people respond to this application. You don't have to send out a list of priorities and then evaluate it based on that. That being said, it may make creating the rubric easier, but it's really up to you.
Okay. All right.
Yeah, and I think I would, you know, Courtney, I would just sort of echo or highlight Dr. Johnson's comment that, you know, you've got a lot of flexibility about how you want to distribute funds. This is a vehicle. It's kind of one way to do it. There may be other ways. And this vehicle itself, as I've tried to emphasize, you know, is just sort of starting out the concepts of it.
Okay. I guess I'm just really hoping that it's as simple as humanly possible, like almost as simple as like the Franklin County's open call for applications. They had like a website and it was almost, I think it was a 13-page document, and it seemed like they were receiving applications without telling people exactly what they wanted. So they weren't like, we want a detox center in Washington County or whatever. I made that up. But they were like, we have this money, tell us what you want to do with it. And then their council members are going to be like scoring those applications, and I'm assuming making a decision together on that. So that, I guess, just how I'm thinking about it, kind of flipping it on its head instead of us saying what our priorities are with some of this money, not all of it, but asking the community what their priorities are and starting there.
Yeah, that I mean, that totally makes sense to me, but that is also what I was envisioning as I put this broad application together. Yeah. Yes,
And
Pat.
just to jump in, sorry, Pat, as Courtney said, it could be far simpler than what's in this grant skeleton. And we could have it be as simple as like a Google form that people complete. What I really appreciate that Ella did with this is she pulled together, all these examples of what other states are doing for the council's consideration. And so we're either checking these boxes or not checking them, but we're having the discussion around them regardless. And so again, we can go either way, but I think this is a really good starting place and also like a grounding document for us to have moving forward.
Yes, thank you for that explanation, Mary. Pat?
So I just want to say, nice job in putting this together. I think at another time we can look through this when we have a chance for me to dig into it deeper and to look over. I do believe that it is a process that we can use, modify it when we need to, look at it how we see fit. And I think I'm probably going to differ a little from Courtney. I see the council setting priorities and setting the RFPs out into where the priorities, and the priorities that we're setting were based on surveys, public comments, the council data, and all sorts of things. So I don't see us, maybe just me, sending an open-ended RFP out saying, here at it. I do see that that's the whole work that we've been doing, is looking at our priorities, looking at the public's priority, looking at the survey, and then narrowing it down as we do either we sole source it or grant it, RFP, whatever we decide. But I do agree that simplicity works. And so we can look at that, but I appreciate the work. Again, it's a little hard to comment because I haven't really dug into the detail, but it's a lot of work and I really appreciate it. Thank you.
Brendan?
Thanks. Sort of hopefully my last comment on this is, the council will, I'm sure have lots of conversations about, how to, the different forms that you can do this, or that, the different ways that you can, as Courtney said, or Pat said, or as well as, different council members will have different interests in terms of, how much detail to put in this document or other application forms. I just want to highlight that there's certain, there will be certain information the council will need to include in like this application and or a contract, because it has reporting obligations up the chain, in various ways. And we're trying to, this project is to try to write in on the front end, those kinds of reporting requirements. You all may have other things that you want people to report about, other information you want to gather, data, other things. So just to make the point about the council's obligations about data, or I'm sorry, not data, but like reporting requirements. Thank you.
I just have a couple of thoughts. One, to your point, Brendan, that I think there's a few things that I sort of think about. One is sort of like Ella raised the contractor, like who's going to do the reporting, the compliance. Like this is a lot of money with all eyes on it. So I think, and we can take this offline and work a little bit before the next time, Ella and Mary and team. And then I think one thing that's really important to me is is the whole reach of the money and having proactive technical assistance. So again, we can talk offline, but if I'm a small shop and I want to pursue this RFP, who can help me? Because for my organization, this 11-page document looks like a dream compared to a SAMHSA RFP. So I think it's pretty simple, but to a smaller organization, this 11-page document might seem overwhelming. So I think we can think about that and then bring it back. But Pat, for you, the question for tomorrow, we are not ready to present this to the full council. Is that a fair? Okay, so we'll
That's
keep working on
absolutely
this.
100% fair. Yes.
And I think in the spirit of time, that Ella and Mary and others that are working on it, let's keep it going, and I can help, we can all help, but let's sort of electronically get to a place with an application, technical support, technical assistance, I should say, simplicity before the next meeting. And if we cannot spend our time sort of, if we can agree, if we can live with it, it'd be great to not have to spend an hour again. You know, I think it looks really good. It looks simple, but we can do whatever we can do to make it even more simple and also to offer support to organizations. And on that note, I would suggest we move on. Any last questions or comments? Thank you, Ellen, Mary, and all. Really good job. So now down to the meat of the conversation. So Mary has put together a spreadsheet with our priorities. And I think just looking at my notes from last time, let me just turn the page. Gordon did a great job at the last meeting talking about kind of where RFPs were at. So Gordon, do you have any update on any of those, the crisis center and other RFPs that were going to be released in December?
Yes, I do, Joe, and some of you know this information. I'm also wondering, you know, we spent quite a bit of time on the state side preparing this. Almost came out to one page. I guess it's 2 pages of existing contracts that could be enhanced in those areas where where the state's interests are frankly aligned with the council's decision. And I assume that was sent over today, that the staff has that. I don't know whether you all have it, that's all.
I don't think everybody has it, Gordon. It came to me and Pat and you, I think, are the only 3 people that it came to. And so I dropped a bunch of that information into this spreadsheet that everybody else has. But not all of it, because it didn't all fit. So it may.
Well, I can tell you the general trust. I mean, that's kind of relevant to Joe's question of me. What we've done is simply taken the 4 pillars and put in the major state contracts we have and indicated where we think, if you wanted to, that those could be vehicles to get money out the door and by enhancing those existing contracts. But we also don't want to be presumptuous, but that's these are available to you. Some of them are kind of easier than others. But just bringing you up to date on the RFPs, the state side, people really worked very hard to get the RFPs out for Washington County's SUD receiving center and the Washington County residential treatment, detox and residential bed, and get those out before tomorrow's meeting, because we didn't want to spending a lot of time on 2 things that now we've done. Now, again, that doesn't mean that these beds are available tomorrow night. It took 2 years from the time an award was made to Milestone to double the beds before a single patient is in one of those new beds. That will be, in my opinion, about 90 days from now. But we put $3.5 million. The Washington County project is $1.5 million for at least 10 at least 10 beds, primarily detox beds. I think it reads some that there could be some detox in some residential beds. But that's we offered $1.5 million for that. Has to be in Washington County. And then in Kennebec County, $2 million for an SUD receiving center that has detox. It has behavioral health. It has there's a lot there, and it's a lot there because that the legislature required that. And but those RFPs are now available to people, and there's 2 informational sessions scheduled for people to listen to further information. And I think the response dates are quite early. They're like in the first half of January, as I recall. So we're very excited about that. If in fact, you know, for instance, you left on the list of priorities, you know, crisis receiving centers, you could take Kennebec County off your list. We have the living room in Portland. We'll have this one in and it would still leave plenty of room to talk about Lewiston or Bangor. So that's I think that's the new stuff, Joe. Thanks, guys.
Great. So do we want to sort of discuss a little bit Gordon's point around investing in existing or enhancing, to his word, some of the work the department's doing? Oh, Kim?
Can I make a process suggestion?
Sure.
So maybe what we could do is go through and we could share the screen of that spreadsheet and go through your priorities. And as we discuss each of those things, maybe talk to Gordon about exactly what he's saying, like what this where it matches the state spreadsheet and what they could do and what the I mean, some of it's also, you know, what would another detox unit cost, and where would be the next place that the state would suggest adding it, for example. So maybe it would make sense to do it that way.
I'm good with that. Liz?
Yeah, I guess I'm just curious of our, like, what is the outcome that we're hoping to get from this meeting for tomorrow? Because then I agree, I'm fine with that process of going through them and saying how do we fund these things and our priorities. I'm totally fine with that. I just want to know what's our outcome for today as we discuss, so we don't get too in the weed, like super in the weeds, if that's not necessary. And when it is necessary, that's fine, but I guess I want to know where we're going.
So per where my head's at, I think last time we spent a lot of time talking in the weeds. So I wrote down sort of, I think the discussion points in the treatment, it was what we just talked about. Prevention was bar, and then talking about where we're at with that. And then we talked a little bit about school. Well, bar was the big one in that. And then I think, I don't know if I got the other ones. The group in terms of harm reduction were SSP supplies, were there was sort of unanimous thinking around last month. And then recovery, I don't know that we spent a lot of time. So I would like to be able to show up tomorrow with, you know, like some recommendations for the full council. That was my hope for today. So I think, Kim, your suggestion, if you could take the reins, and Mary, you might be able to, you're most acquainted with the spreadsheet, and walk us through quick, as you know, and to hopefully get to that result, Liz.
Yeah, that
Yeah,
sounds great. I just think I would love to, there may be places where it's not all about putting the money at where the state is, but just saying like, okay, well, here's what the priority was. What are some options for where that goes? Would be awesome.
Yeah.
I'm down.
Absolutely. And I think there are probably some things too that you guys are not going to decide on today. You're not going to come to agreement, and probably there won't be agreement tomorrow. And so there's maybe defer to another group, or you know, more detail in a different way, right? So I think probably we could get through. Well, let's start it and see, and if it's not working, we can stop and reassess.
Sounds good. Chastity, did you have your hand up? And then Gordon.
Yeah, before we go deep in this, I may be wrong, but my understanding of why we scheduled today before tomorrow, part of it was really diving into the harm reduction piece to figure it out, to have that proposal tomorrow, because that was going to be the easy one that money could go out quickly. So my preference would not be to focus on like all the other ones that have a lot more into the conversation and then miss being able to do the easy.
I like that, Chastity. Gordon.
That is a perfect segue to my comment, which was simply going to be, if we could begin with the harm reduction section, because we've all, many of us, I had a meeting with Liz yesterday, I had a meeting with Courtney this morning, and I kind of honestly feel like I have a lot of information on where there's general consensus and which ones are going to take a lot longer than others. And I think we can accomplish a tremendous amount in this harm reduction area and actually make great progress tomorrow. So I'd like to start with that if that's not an inappropriate request.
Sure, I have pulled out, can I share my screen? Do I have screen share capacity here? Yep, I do. Oh, no, I don't.
You should have it now. I just made you a co-host.
All right, let me share the right screen. Okay, are you seeing that? Are you seeing the spreadsheet with harm reduction as the thing that's up?
Not quite yet.
I am not.
Are you seeing anything?
Not
It
yet.
just says that Kim Johnson has started screen sharing. It doesn't actually show your screen, which is weird.
Oh, it says your screen share is
Oh,
loading.
there it
we
is.
go.
Oh,
Yep.
yeah, that was slow. Okay. Okay, so you're seeing the right thing now? So these are the top two that you had for harm reduction, the mobile units and the beds. Is that the ones that you wanted to talk about?
No, frankly.
No.
But
What we
the
talked
bed-
about last time was we said 100 and then we said $150,000 over 2 years for each certified SSP. So it was the SSP specific.
So
Yeah.
Kim, there was under the other spreadsheet we had that set out priorities. This harm reduction one they're talking about, the unrestricted flex funds, got 5 votes.
Okay, so I don't know how it got dropped off this one. Okay, let's just talk about, we don't have to talk about it on the spreadsheet. Go ahead. So we had last week, we talked about the unrestricted funds for the SSPs, and we had talked about a dollar amount, right? Like 100, was it 150 over 2 years, 75 each year?
Yes.
Yep.
So we will get that added back to the spreadsheet before it goes to everybody. Is there any other discussion point, or you just want to distribute it equally between all of the SSPs, and how much would that total be?
Gordon,
yeah.
go ahead, Gordon, and then Courtney. I'm just trying to.
Okay, so I think we had talked about sites as opposed to operators of, so there's some operators, there's at least 16 sites where we do syringe programs, and those 16 sites might be, operated by 6 different contractors. That 6 may not be the exact number. But I think it was Chastity who's got the most practical experience in this area that suggested that it ought to be based on location and not on operators. And my idea would be to use our existing these to get help. They'd have to be certified. They'd have to be one of the certified locations by the CDC, which regulates the SSPs. And as I say, there's at least 16 sites. There's one new one that was just approved in November. So there might be 17. And it's important that you have a little of this history, that until 2018, they didn't receive any state funds whatsoever. We've had it, the first one was in Portland almost like 25 years ago, but they had no state funding. So over a series of years, we were able to get about $1 million a year to support those activities. But as there's been more and more exchanges, that $1 million really doesn't go that far. And so there's not been enough money for outreach. There's really not been enough money for supplies. So, and these are the people, after all, that are on the ground working with people who are using drugs. The people who are still using drugs are the very people we're trying to keep alive and give them an opportunity for recovery. So I think it's the highest priority, at least on the state side, along with more detox beds, frankly. But if we could use the existing structure and offer each of the sites an opportunity to apply for up to, let's say, $75,000 a year over 2 years, a year for 2 years. So that'd be 150, or even depending on how the numbers work out and how much money you want to put into harm reduction, could even be maybe $100,000 a year for up to 2 years, because we don't know that all of them will apply for the whole amount. And you wouldn't just, they'd have to show us a budget and what they would do, what they think they'd be able to accomplish, and they have to, with the new money. But I'd really like to have it be very flexible, as we talked about the last meeting. Flexible funding, not many strings attached, except that they would have to be within the parameters of our opioid mitigation and remediation document, of course. But they could buy supplies, they could do outreach, because that's how our numbers are getting a little better. And this is one of the reasons that we're able to reach the people that are most at risk. So that I think is the lowest hanging fruit, because you could do it so quickly. We would just amend, we could use the existing contracts and just enhance those once we saw the applications.
Courtney has her hand up, and Joe, you might have to pay attention to whose hands up, because I can't see.
Yeah, and Pat had her hand up. Courtney, then Pat, then Todd.
Yeah, I'll try to be super short-winded about this, but long story short, I 100% agree with Gordon. The only thing I'll add to it is that taking a step a little bit farther back from just harm reduction, just putting it in the context, we have $15 million to spend this year. I think that, I continue to advocate that I think each of the pillars should get the same amount of money. And if we were to do that, that would be about $3.5 million per pillar, with $1 million set aside for administrative expenses / Mary's position / anything else this council needs, plus the 3% for schools. And on that note, I do think there's a lot of agreement on many of the pillars, not just the harm reduction. I think that we could almost even get out a package. I'm hoping for at least one thing in each of the pillars that we can send out as a package, so that our community sees that we're really moving. So, I would be super supportive of the $100,000 a year for 2 years for harm reduction programs across Maine. I would be super supportive of 2 new detox centers in communities that don't currently have them. Very supportive. I want to look to Liz a little bit more around prevention, and then also a recovery community center in a community that doesn't currently have one, which is Piscataquis County. Yeah, that was my attempt to be short-winded and hopefully get us to moving a whole package of for each pillar.
Brittany, I like your thinking. If we could get 4 things out all at once, that would be great. I think Pat, Joe, you said.
Yeah, mine was just basically Gordon said what I needed to say. I think it is a great idea. I think that we could easily get an application process out and make sure that we have a budget, make sure that there's deliverables, and I think we could get that where it needs to go in an easy way. But I'm absolutely in favor of it. Again, as long as there's an application process and budgets and deliverables. I don't have a problem.
Todd.
Yeah, I was just going to ask Gordon really quickly. Are these the SSB sites? You talked about 16 sites. Are they in all 16 counties?
No, they're not, Todd. And we would want to probably set aside some for to incentivize new locations in counties where there are no exchanges. But as you know, as a sheriff, these are, they're well accepted normally, but this would be a heavy lift in Piscataquis County, to tell you the truth. So we'd want to incentivize them. We have been successful in getting into some rural counties. We've been in Washington County a long time. There is an exchange now in Aroostook County. I think there's something going on in Somerset County, but they're not in
Franklin County was
every
just
county.
added.
Franklin County just got certified, and they're in 2.
But they have no money, right?
They have no money, right? And so that's why I think that, again, but the idea would be, and Pat talked about an application. In this each of our initiatives, can, we don't have to have the same process for each one. In this case, because the eligibility is tied to certification, you almost don't need an application. You simply need a communication to these now 16 or 17, well, the vendors that do that operation, and say, we have an opportunity here. Would like to give you an opportunity to apply. This is the information that we need. It could be very, very simple because our pool of grantees is fixed. There's only like seven organizations. At the same time, we could set aside some in case there is a new organization or an existing organization that wants to expand to a new location, and that should be a different pool of money.
Thank you. I like the concept, and I like where Courtney's going. I mean, it seems to me that if we're gonna pump some money out relatively quickly, I like the direction we're going in. It'd be cool if we could touch the whole state.
Hannah,
And-
you have your hand up. Did I miss somebody else?
Oh, yeah. No, I totally agree. Would love to see this money get out soon and also to different pillars. Just wanted to make sure when we say also unrestricted funding, I think we talked about making sure that like smoking supplies and wound care, all that is
We're just going to talk about supplies in their discretion, whatever they
General
need.
funding, Kina.
Out-
funding. I
flexible
just
funding.
want to make sure that that includes, but general funding. The other thing was actually you sort of answered my question, Gordon, was like, can we just make this simpler for existing SSPs? So if we can.
Absolutely. And just, well, probably rudely took the floor. Courtney, I think you meant to say counties that did not have
Yes.
a detox, and instead of communities, you meant to say counties in two instances in your very articulate comment there.
Yes, you are correct. And yes, I would like to see us put out a package, the harm reduction package. I would like to see 2 new detox centers in counties that do not currently have one, prevention effort and a recovery community center in a county that does not currently have one. I think that we can get there as a group and then figure out the rest later.
So
I
here's the
like that
question.
too.
Oh, go ahead.
I think that can we, just in the spirit of keeping moving, Liz, I like her idea about, change, just adding it to people's contracts. Can we simplify this and move on? I think everyone's in supportive to make a recommendation to the council tomorrow, and then we can figure out the logistics. We've got the dollar amount, we've got sort of the roadmap. Are we good to move on to the next two detoxes in 2 counties?
So here, let me move the spreadsheet up to the detox. So the question becomes for detox, I guess, which counties does this, Gordon, would you recommend next? And then, I guess, how much do you guys want to spend on it?
Okay, we don't have, the eligible counties, if we use Courtney's language of any county that didn't presently have a freestanding or otherwise detox, there are 2 hospitals certified to do detox, and that's St. Mary's and Penn Bay. But otherwise than that, we unfortunately, we have so few freestanding detox that we know exactly where they are. We now have 2 beds in Aroostook County, but there are no detox facilities I don't think there's really any in Lincoln County, Todd. There are none in Oxford County, Somerset County, Piscataquis County.
Might be just easier to answer what does have detox center.
Oh, well, okay. Now we've committed, we will have them in Washington County. We'll have one in Kennebec County. They are already in Penobscot County. Fortunately, we have 2 there. We're opening up the Wabanaki 10 detox beds on Friday. And we have Wellspring up there, and then we have Milestone, obviously, in Portland. I don't think that there's detox available in York County, if you can believe that. So we only have about Washington, Aroostook, Penobscot, Kennebec, and now, well, Knox, if you count Penn Bay. And so, yeah, I think we have maybe them in 6 counties, which means we have 10 counties that have no detox. So those counties would all be eligible to have somebody put together a proposal to get to open up detox beds. And these take a while. I said it took two years for Milestone to expand its beds. So that's why it's important, I think, to get it started. Let's see who's interested in the money and be committed to do that. And one of the issues, honestly, and we'll have to come to this eventually in other ways, is it's easy to give them money to build, renovate, buy land, put in a building, put in equipment. Somebody's got to work there, and the workforce issue that we've identified as a challenge we'll have to work with that vendor who says, okay, I'm going to put, a 10-bed unit in Greenville. They'd have to convince us that they could actually do that and find people up there to work.
Definitely. Bruce and then Chastity posed a good question in the chat. So Bruce, go ahead, and then maybe Chastity. I was thinking the same thing.
Yeah, I was more on one. It was on the York County project that's already, moving forward. And to my recollection, there was going to be some detox available there. And I'm just kind of putting my vote in and just thinking about, I'm sitting in Androscoggin County right now, and we have just a massive problem here, and not like any, and unlike, it's like other communities. But the other part is that I think we all did agree that that we would have kind of an overarching umbrella of rural focus on the things that we do, and I just think it would be quite symbolic if we did do something in Androscoggin County, but then the next place that we would go would be to a rural community or a rural region or rural counties. I just think it's a move in the right direction. Rural counties are left behind in so many circumstances and situations. I know that Androscoggin County, Lewiston Auburn is a kind of a city area, and there is rural parts of Androscoggin County, but I don't think that qualifies. I really think we need to focus on a centrally located regional rural detox.
Well, it says the hands
Okay.
up. Is it just Gordon again?
Gordon again, yep.
So just to respond, the state sometimes will do an urban and rural project. So there is a clear precedent for saying one in an rural area, one, and we could give you that language to do. I also think in thinking this through, we should, in my opinion, talk about freestanding detox beds so that we don't exclude Androscoggin and Knox County because the two hospitals happen to be licensed to do detox. Because they don't come close to meeting the demand. And we almost all agree now, frankly, that even the emergency room of a hospital is really, or a hospital is not the best place to do detox. So I think we could talk about freestanding so that Knox and Androscoggin are not excluded.
Definitely.
Thank you for clarifying that, Gordon. And I think that's the key to the whole conversation, is that we are bringing people to the local detoxes here, and we are in Kennebec County, and folks are being turned away. Mm-hmm. So that it's not a viable option. It needs to be freestanding.
100% agree. Hospitals are not detox centers when I say the word detox center.
So this is actually one of the things that on Ben's spreadsheet that he said the state would be, or the department, I guess, I don't know that he's speaking for the whole state, but that the department would be, I think, willing to manage the process for you if you were interested in that.
I think what he means is that given that we just put a lot of effort into doing an RFP for a freestanding or detox beds in Washington County, that if you need help in putting this language together, that we have the infrastructure to quite easily help on that one.
Pat, you're up next.
And I just want to know, did I miss it? How much money were we talking?
Yeah, well, I think it's based, Pat, on the fact that we felt that we could do 10 beds, no more than $150,000 a bed, but we put $1.5 million into that facility that frankly, well, it's going to be in Washington County. It'll probably be in Machias or Calais, one would think. So that's where I would probably start that discussion, is to think that for $3 million, we could probably do two 10-bed facilities, freestanding. And again, we don't have to worry about, well, we have to worry about it, but we're not responsible for the sustainability. The idea is we're a catalyst. Help them buy the land, help them get the building, help them do the renovation, help them train the staff, help them fill up the beds. And then once the beds are filled and they're operating, Maine Care, honestly, and maybe some uninsured contracts from OBH would be the sustainability. In other words, Wellspring and Milestone on their detox program, they break even. It's not, you're not going to make a lot of money, but they can be operated. We almost doubled the Maine Care rate for detox. And that's one reason why these will be sustainable. We're just helping them get started.
Courtney.
I have a question, and I really don't know the answer to this. Would it make sense to do what the state just did, but do it again? So like in Androscoggin County, hypothetically, or in a more urban county, to do this SUD/detox center like Kennebec County is getting, because it's a step up, right? It's a 24-hour, 7-day a week. The intention is 24-hour, 7-day a week place where police officers or community members alike can take folks 24/7 to get the help they need and navigate through that system appropriately, whether or not that's a detox on site or an outpatient, etc. And it's only $500,000 more, and it would work in Androscoggin County, I would assume, in Lewiston or Auburn.
Joe,
It really was a question for you, Gordon.
Yeah, okay. So I understand, but I would just posit the following consideration. Number one, no one's ever done an SUD receiving center as is in that RFP. All those things, all those elements are in there because the legislature put them in the bill. So they're required to do it. There is a real possibility that no one will apply to do this because nobody's ever operated such a thing, as opposed to freestanding detox, where in fact, you have a clear pathway. You can see what Wellspring does, see what Milestone does. So I really want to see, we'll know in 30 days or 45 days whether anybody's interested in doing a free, an SUD receiving center that's got all those things in it. So my answer might be completely different once I see that, yep, there's actually credible organizations that want to do all those things. But boy, I'd hate to see us put our money in that basket yet until we see what happens in the very first one that's ever been designed.
My very quick response would just be like, if we are actually going to save lives, then we're going to have to do new things. And it's hard to do new things, but I do think that it is possible to do new things, and that Androscoggin County would be a place where we could do new things. But I'll let it go.
So I think to Ben's offer about, investing in what the department's doing, that might be the best strategy for this money. And so, one pillar, if we just work with existing contracts and add new, that sort of gets to the process. And then with this detox, I think we're in agreement. If we could, I agree with you, Courtney, like it's a new day. We have to sort of stay with sort of ideas, but I think investing in what's already in play, and then adding Andro, if that's the county, might be the easiest way to go about it.
Well, actually, Joe, that's an excellent idea, because what you're suggesting, I think, is that we just take the RFP that we just put out there for Washington County we had to do Washington County because the legislature picked Washington County and Kennebec County. We have the ability as a council to pick 2 different counties. And we could pick Androscoggin, and then you can pick your rural county, and then just ask the Office of Behavioral Health. We'd have to give them, when the time comes, the money, but they would simply issue 2 more RFPs directed to 2 more counties. It's a brilliant suggestion.
And I think in terms of Gordon, your point around sustainability, they have it's them that the department's going to sustain it, OBH, over the years after we're moved on from these chairs. I mean, Maine Care, funding for uninsured. So I think it's something I get thinking if we could just keep this ball moving, keep it moving so that if we're in agreement, then we can bring this idea and then be in conversation with OBH. Pat, then Bruce, or vice versa.
So the agreement is they were going to fund 2 detox centers using the state RFP process at, what was it, about 3.5 million?
One,
3
one,
million.
1.5 annually. They would each, it would be $3 million total, and one-time money, which would be nice.
Okay, and so here's the silly question I have. If we ask the state to take this on and do it, is the state going to ask any administrative funding to put out another RFP?
Well, I think not. I can't speak for the Office of Behavioral Health. I'm not in it. I can't speak for the department because I'm not in that department. But I think knowing that that's a pretty easy lift. We've already drafted it. You change Washington County to another county, and that's a pretty light lift. So I would encourage Ben not to believe that would be a heavy one. Ben's concern is that we've got enough bandwidth to help with 2 or 3 of these projects, but we can't go to HHS where when 1 out of every 6 positions in state government is vacant and manage 20 of them without more resources. But honestly, this one would be really quite a light lift, I think. And now, and again, we wouldn't be asking them to necessarily score the applications. We would be taking that on. We're just using their model of an RFP to get the information out there to potential applicants.
But would we do that, Gordon, or would we just invest in their, would we pass it over to them?
I wouldn't. I'd only ask them to put out, because it's a different decision maker, and we're not the state. It's not state money. That's not offensive to them. And how they score is quite complicated. And it's just like the appeal thing. I don't want to buy into all the state procurement just because we're going to use their RFP. We're just going to borrow their RFP template and use their resources to get it out to on the state's website, however they publish it. And then we'll take it from there. Thank you very much. The applications will be coming in. Maybe we'd ask them to get the applications and then send them over to us.
Okay, awesome. Okay, Bruce.
A couple of things. One, I just hope that we as a council group and the council does not forget about that there needs to be some next steps after the detox. Where are folks going to go after detox in this community or any other community? So that this is the low hanging fruit, and that we are thinking about what sort of treatment is going to be made available and how we can help make that kind of treatment available after detox. The other thing is kind of a question about augmenting contracts, and this goes back to the harm reduction piece. I know that with a contract that we changed with the Office of Behavioral Health, there was a lot of red letters and red lines and a lot of work that went in that a couple of people put in at OBH. So I just want to make sure that are there going to be administrative costs with that, augmenting the harm reduction, whatever the harm reduction contracts look like. And I also want to echo what Chastity said. It wouldn't it be great if we could come up with a rural county that we agree on. It seems that we have agreement on Androscoggin. Could we come to an agreement about which rural county we want to step toward today?
Well, Franklin County's been put up there, been suggested. Go ahead, Gordon.
Franklin's done. Franklin's already certified. So I think the
Go-
answer.
For the detox.
Franklin
Gordon,
has
I'm
a
sorry.
detox.
I'm not thinking about
talking
detox. I'm thinking about detox, Gordon. I'm
Oh,
sorry.
Yeah.
I'm wrong about that. I just strike that. It's late in the
Yeah.
day. Diet. Yes, you're right. Let's see. There is no detox in Franklin County. Well, my only point was going to be, yes, we should pick a county, and it should be a county that can also borrow people from another county. So, we're not going to put it in probably Jackman because that's a long ride from other counties. So, if we've decided that there isn't anything in, unfortunately, nothing in Lincoln, and Knox is, York's an interesting dilemma because that facility that the county is designing is not under construction. It's going to be 3 years before you see anybody there. So I would
Fighting over the land now. I mean, there's a whole issue now with the
Right.
land they want to
So
use.
I wouldn't necessarily say that we shouldn't do anything in York County because of that project. So anyway, I think somewhere over like Piscataqua, Somerset, Oxford, in where people could reasonably drive to. I mean, people drive up to, a long ways to get detox because we have so few beds. But I'd want to see it, like located so that people from all those particular counties could access a bed.
Bruce.
Sorry to jump in again about counties. I like the suggestion of Franklin because Franklin County has a lot of cooperation with Oxford County. They also have a great deal of cooperation with Somerset County. So you've kind of got it centrally located between those two counties. Franklin would get my vote, at least at this moment. And I don't ever want to leave out York County. I love York County, but I really would like to see rural counties represented in this second option for a detox.
There's also an argument to be made that Oxford could get to Andro or Oxford could get to Cumberland. Like
Yeah.
we're starting to circle Oxford County with detoxes and Somerset kind of the same. Not the top half, but
You could also make it regional, right? So you're not picking a county, but you're saying it could be
Regional.
yes, something like that. So that you'd have. I mean, I don't know what the example would be, but if you wanted Franklin so that they would cover multiple counties and it might be located in a different county, but that it would serve those counties.
Right. And
well, I like that idea. Like the RFP.
So
Yeah.
sorry, Courtney, it's regional, right? So, and this is the neat thing about talking about rural communities. Courtney's absolutely right. The folks that are in South Paris and Oxford Lewiston Auburn is their hub. That they go there for virtually everything. But Rumford and Mexico are light years away, and they're closer to access to things in Farmington. So anyway, that would be my argument for Franklin.
Yeah, people don't think about counties. I mean, that's not how real people think about like it's in this county, right? They think about driving distance.
Right. Liz, your hand was up.
Oh, yeah, no, I'm fine. Let's just finish this and then
So-
I'm just mindful of the time, so.
Okay, great. I think that we've got a plan for tomorrow. Again, it'll be deliberated there. So I think if we show up with recommendations around Andrew and Franklin, our SSP recommendation, it'll get more discussion tomorrow. Does that sound good? And then Liz and then Todd, or vice versa.
Yeah, so this is where I would love to share with you all a couple things on the prevention one, if we want to have a prevention piece to go forward. So if
And could I just
wanna go
ask you,
there, or-
Todd, is your question about the detox, or are you ready to move on to another pillar?
Well, I'm ready to move on to another pillar. What I'm interested, I know we're running out of time, and I know we talked about a bunch of different things last meeting. I would just like to see if it's possible in this first round of money, to see some funds go out statewide. And I don't know I don't care which pillar it fits in. You know, we've identified those areas that need the most. I'm sitting in a county here who is too close to everybody else, so you know, we'll probably be the last to get the detox beds, which is fine. That's not about Lincoln County, but we have a couple of resources down here that are struggling, and they're trying to you know, fill these gaps with where do we send people if we can't get a detox bed? Where do we find a safe place for them to stay? You know, all these I don't know what you want to call it, stabilization funds, maybe that Liz talked about a little bit last time. You know, things that we can, it doesn't have to be lots of money. I just think, you know, $50,000 in Lincoln County or $25,000 in Lincoln County might go a long way to help some of these things that we might be able to do in the first wave. And I don't know where that fits or what pillar it fits under, but I just feel strongly about that.
Well, it
maybe
can
that is
fit under the
prevention.
prevention. It can fit under prevention, Todd. I think there's a way for it to go there. If you want me to, I can share a couple of thoughts.
Can I just say this before, Liz, before you dive in, that I think that, Todd, to your point, as we sort of figure out the roadmap, I think that what we'll have to think about is just if there's 3.5 million, how much can get carved out to do what you're describing. So I think we're going to get there. I hope we get there. We're just talking about these big initiatives, but I think we're going to have to really look at the buckets of money in each of the pillars. And go ahead, Liz, now take it away.
Great. I just wanted to, I shared with you all you can either let me screen share, or I just put it in the chat if you want to pull up. I just wanted to share real quickly that I think that this idea of having one thing to fund in every pillar is like great in theory, and I'm down with it. I just want to advocate though that prevention is to do prevention that's most effective, it does require us to do things in different areas where young people are and live. And so preventing substance use disorder, I just want to share with you all that it's really, I know we sort of know this stuff, but it's really about supporting individual resilience, but also really helping young people build, have protective factors in other areas, in their families, in their schools, in their communities, and in their organizations. So I think we got to last time the family level where there was really providing funding to those to flexible funding for families, and that this could be done through family services, whole family services contracts that already exist, or it could be done through philanthropy. John T. Gorman Foundation already sort of funds some of this work. There's the Community Caring Collaborative up in Washington County, I think I shared last time. They do this kind of stuff. It supports young people and their families who've been most impacted. I think at the school level, there was BAR, right? So that supports young people in their schools. It gets schools on board with being able to support young people who are struggling. And then I think there's some of us who've been meeting and talking about supporting youth serving organizations. And the youth serving, there are two, Peter Elfond Foundation has a peer learning cohort of a bunch of youth serving organizations, and the Maine Youth Action Network directly funds youth advocacy projects that if you funded both of them, they could support those organizations through their learning cohorts and learning models. So you'd be really supporting young people at that individual, family, and school level. In terms of community level, I would like to bring to us to suggest that we ask the Prevention Technology Transfer Center that's a part of AdCare. They get SAMHSA funding already to do this work, but to really support a prevention work group. So it's not just me sharing with you what I think, I've been talking to lots of people, so I'm bringing to you things that I've talked about with lots of people who do this work. But I guess my suggestion would be to have a work group made up of folks who do work at that individual, family, school, and prevention work, overarching prevention work, to come together and really come up with some long-term strategies and long-term strategies for the council to consider. And that would be free to us. It's free technical assistance that AdCare could provide for us, where they run a work group that then provides some recommendations. So those would be my recommendations. It gets us to 3 million if we provided 1.5 million to youth serving organizations, 700,000 a year for those family flexible funds, and then the 800,000 that would get the DOE to really be able to do that full implementation of the 71 schools for year 2. So it's not one thing. It's
2 of these were already on the list that people
they
voted
were.
for.
The 2 things were on the list.
Go ahead, Gordon.
You're
unmuted.
muted.
I agree with the general thrust of what Liz has suggested, particularly supporting immediately the youth serving organizations and taking a little more time to think about other prevention strategies. We don't have to make a final decision on BAR because they don't need the money until September. And I think there's some work to be done before I'd be even on this, even I would be willing. A little more work needs to be done with respect to the work of the Maine Prevention Network. Those are the contractors that the CDC has doing the prevention work in the 8 public health districts. Wabanaki is the 9th public health district. So I love that idea. My question of Liz is, there's 25 youth serving organizations in the Peter Alfond cohort, 28 actually, and I like Tree Street Youth, Mid-Coast Youth Center. There's some tremendous work being done there in the community, and to give them even a little bit of money each would be fantastic. And then there's about 8 other organizations, frankly, that others have identified that are mostly in the cohort associated with, say, the Maine Youth Action Network and some of what the Opportunity Alliance supports. So I'm wondering if, rather than having potentially 35 contracts, if it would be possible to just have 2, the Opportunity Alliance to manage their cohort and the Peter Alfond Foundation, a 501c3 foundation, to manage its cohort, so that they're doing a lot of the administrative work rather than our tiny staff. Do you think that might be possible?
Yeah, I mean, that's what I think I was suggesting here, is that you give the money to them and they are able to, one, they could fund directly to those organizations, but they also could figure out how to use those funds to support sustainability for those foundations, so that they aren't left with, when the money starts to become less and less, that they don't lose the staff that they gain through this. So we would want there to be some amount of work happening at the Mayan and Peter Alfond Foundation to support those organizations for sustainability. Maybe it's that the groups come together and they hire somebody that does some grant writing for them. I'm not sure what it is, but I think that those 2 organizations would have some good ideas about how to do that, while you also directly have them fund directly the organizations that they're working with.
So do you want to, just because we are running out of time, do you want to, I think I've sort of highlighted these, hopefully you can see, do you want to make the recommendation to the larger group tomorrow on these 2 items, and then recommend that the remaining, that you still have the 3 million that you want to spend on this category, and that the remaining money, which I guess would be about, well, it would be less, it wouldn't be that much, I guess, if you only have 3 million and not 3.5 million.
That's 3 million, 1.5 and 700,000 plus 800,000 is 3 million.
Right. I think BAR is going to be controversial, Liz. I think we probably need to leave BAR like off the recommendation because a couple things. One is the dollar amount, but the other is that, like, there's a whole supplementation issue with that. So, and I know that several people are going to argue against it. So I'm sort of thinking, and Pat's probably raising her hand for this purpose. And Pat, since you're coughing, if I'm wrong, tell me, that all the school funding is going to have a discussion anyway, and it might make sense to include that with the 3% set aside.
Yeah, this actually, I'm going to recommend at the meeting on Thursday that we have a separate subgroup for schools. And so that group would be looking at the MOU with the 3%, and they're also will be eligible for other funding, but there be a separate group that actually talks about schools.
Okay, that's fine with me. I guess I would then advocate for then not spending more money in the other places and letting the PTTC, I recommend doing that prevention work group, because if you allocate it to other things that are ongoing, I worry that then there will not be other additional money for prevention of things that I think are important. So I guess at 1.5 for the youth serving organizations and 700,000 for the family level, I would advocate for keeping that, but also advocate for, if people are willing to do this thing that's free, to have the PTTC do a prevention work group for us.
So I
That's
just,
the proposal. Oh, go ahead, Joe.
I think, Liz, this is laid out really well. And Pat, if we have time, maybe we just pick up this conversation tomorrow. I think there's general agreement. And then to your suggestions, Kim, we can carve out. But Liz, if you could just be prepared to pick right up tomorrow, because there seems to be a lot of agreement. Does that make sense?
Yeah.
With your document?
Yeah, sure thing.
And then, but so the recommendation of this committee, people have their hands raised, but the recommendation of the committee would be the first two things, the last thing, which is free, not a dollar amount attached to it. And then the fourth thing, the bar would be part of the discussion.
Yeah. Okay, Todd, then Gordon.
I'm just trying to, I don't mean to be a stick in the mud, but I don't see in the recommendation, or maybe I'm missing it, maybe it's in the details, but I think of our local recovery centers in each county, projects like that. I remember the folks, I can't remember the project, the folks that came from Lincoln, for example, the town of Lincoln, that spoke at our public hearing. I can't speak for that particular program, but it sounded like, a small amount of money would be a significant amount of help to them. I'm thinking of our new common space, recovery center, the Community Resource Council in Boothbay Harbor. I'm trying to see, and these are all.
Todd, I have a suggestion that directly relates to the recovery center, if you'd be willing to hear it.
I'm to hear it. I'm just gonna. I personally gonna. It's just easier for me to get my mind around. If we don't forget, a small amount of money for some of these folks who are already there, established, similar to what you're talking about in other areas. If we can't help them out a little bit in this first round, just make something available for them to reach into if they choose to.
So my suggestion under the recovery pillar is to provide $50,000 to every operating recovery community center in the state already. I believe there's 19, maybe Gordon can correct me on that number, which would be $950,000, and it would hit almost every county in Maine, except for the one county, which is Piscataquis County, that does not currently have one. And so I would offer and suggest that we also provide more startup funding for Piscataquis County at like 200,000. I made that number up. I could be argued against that number. Rounded out to about $1.2 million going out to recovery centers, and that would hit every county in Maine. And I would suggest that it's general funding, like the money that we're giving to the harm reduction programs.
I would caution that you give it to every recovery center.
I did. That's what I said.
I would like to see how much money that they are currently receiving. And some of them, I can tell you right now, I know the barn, they just received a whole lot of money, ARPA money. And I'm not sure they need that money. And Piscataquis County is up there, not with anything. So I'm not so sure I'd blanket it until I knew what each center is receiving, before I would blanket it. But I agree with everything else, but that's the only part I would disagree with. I'd have to see a spreadsheet.
You have a lot of hands.
I'm totally jumping in. I just want to say this quickly and I'll get out of the way. The RFPs just went out recently for 22 recovery centers. And I think once we get the answers from those about who actually received funding and what funding they received, I think Courtney's idea is great. It's just, we need to find out how much funding these centers that just applied, how much funding they're getting.
So then maybe we can't get it out as a package.
Or
I
you
think
could
in
say
theory
that's what
we
you're
can.
gonna do, but not put it out yet, right? So it doesn't have to, like, you could say, this is our plan. And you could also do something like what you were doing with the SSPs, is that they have to propose something, right? Like, we want 50,000, or we want 25 for X.
Okay, Gordon and or Todd, I'm not sure which one we will. Go ahead, Gordon, you're at the top of my screen.
We had not talked about we had not gotten to the recovery pillar. So we've now backdoored it and had a few minutes discussion about it, which is good. And I agree that we need to wait a little bit of time because of those 22 applications and they're being scored. And there's only one county that doesn't have one. We would deal with that. So I agree with this whole approach, but I just wanted to remind Sheriff Brackett that the only reason that we don't have something statewide that we've talked about is that we did not get to that fourth pillar. The other point, and I let Liz know about this a few hours ago, I think that I'm very much in favor of this families thing, of making available to families that are struggling, if they need a month's rent, if they need a new tire on their car, they need money to get their license back. This would be so meaningful to families. But that, to me, is more appropriate in the recovery pillar than it is in the prevention pillar. And there's more money, there's less demand, in my opinion, on that recovery pillar, because honestly, if the state has done anything right, we've done a lot of things right. We've put a lot into recovery coaches, recovery centers, recovery residences. So we may be able to say, well, so I would move that money and take it out of the recovery pillar so that we have more money for those youth serving organizations. Because if we have 35 of them, there isn't enough money in Liz's proposal to really give them the kind of help that I'd like to give them. So I leave it at that. I've talked way too much, and I apologize.
Todd,
I
and
just
then
want to say that,
oh,
sorry.
oh, go ahead.
Well,
ahead.
I'll just say that I'm happy to give them through recovery centers, but as recovery work, but I also think doing it through the parent work that's already happening is prevention. And it doesn't have to be, it may be that somebody lost a family member who already died from a substance use disorder or had an overdose death, or their family's incarcerated, or they have been impacted in some ways. They live in a community that has a ton of substance use disorder. It is good prevention to have families be stable. So I guess I would say that you could, and many of those people will not seek out a recovery center for that work. There's already all this stuff happening around whole family services that I think it fits into in that flexible funding space. I actually would be great with it in both places if you wanted to put some of it from prevention and some of it from recovery. But I also would advocate for holding on to some of the prevention funds before we allocate them, because once you allocate them to ongoing funding for youth serving organizations, 1.5 million is a lot of money. I would like for the work group to have some work to suggest some things, because once you allocate it, it's going to be really hard to unallocate that as ongoing funds.
Gordon,
Absolutely.
clarifying question. You weren't saying to give the money to recovery centers. You were just saying to use the recovery pot of money at the council to fund the proposal, correct?
Right. No, I'd want to do it through, the CAP agencies.
Okay, Liz, he's just trying to move it over to the recovery pot money.
Got it. I see what you're saying. When you wrote to me, I thought you were saying it through the recovery contracts.
No, I didn't mean that.
Okay.
No, just meant that that's where I would, and honestly, we don't have to have equal amounts in each of our pillars. We have complete control of that. But I mean, it's a little bit prevention, Liz. It's a little bit recovery support.
Totally. It's
but
both,
I think
for
there's
sure.
less demand on our recovery pieces right now, immediately, than there is on the prevention.
Okay, Todd, go ahead.
My only point to follow up is I'm trying to follow all this and understand it, recovery center versus whatever else. I think I'm talking more about what Gordon's talking about. And I like Courtney's idea, not necessarily of just sending out a check, but if we could make an amount of money like $50,000 available in each county is in this first wave, for these organizations like Gordon just referred to apply for, and get some of those funds out there, I'd be tickled pink. And I think we're really getting at a beginning, to allow those, whether it's some of the organizations that Liz just mentioned, whether it's, the community navigators, with a Y down. I can go on and on. You guys know better than I do. You deal with it, more than I do, but I just think that's really important.
Definitely. Liz,
well, Todd, the families, the money that would go to, that we're talking about for the, flexible funding, that my proposal is to have that go through the CAP agencies. And there are 16 or 15 CAP agencies that cover the counties across. So everyone would be eligible for it. So again, it would be one of those things that's why I wanted to present that stuff in terms of your conversation, or your comment, because I think it would be something that would impact families.
Again, I'm
across the
just
whole
I'm just trying to follow you, Liz, right? So if it goes to a CAP agency, you mean individuals could apply to CAP to get that funding? Or are you
So-
talking, or could organizations like Healthy Lincoln County apply to CAP, or would they apply to right directly to the council is what I'm talking about, with that money available in each county? I'm just trying to follow, forgive me if I'm not following the acronyms.
Okay,
And
yeah, I guess we're talking about different things. I thought you were saying you wanted to make sure that that there was funding in every county. And the funding I'm talking about for flexible funding for families, that would be that that the individuals are able to apply for funding from the CAP agencies to support their housing and, car payment or stuff like that. But you're
right. I don't mean to cut you off. I'm sorry.
No, go ahead. I think you're suggesting something totally different. And I would
Well-
say that the counties do have opioid settlement funds that they all have access to, that's over 50,000, but I'm also down with supporting more
Not all
things.
of them, but a lot of them do. Not all of them, but and I agree that those funds should be considered. But I just, again, I don't want to beat a dead horse, but I just really think it's important to have that. The folks that are supporting, is helping folks get from here to Augusta so they can get to detox. Whatever it is, those funds are badly needed, right here in Lincoln County, and I'm sure in other counties. That's why I don't know how we do it, whether it goes through the recovery center, whether we just open up, and allow some of those organizations to apply for a small amount in this first round. I'd really like to see that.
Todd, I think you and I were talking about the same thing as I was saying earlier, like an open application process for communities. That's exactly what I was trying to say earlier too.
so we're getting on the hour or the end of the meeting. I think it makes sense. Kim and Mary and Ella and Pat, if we could sort of like tomorrow try to put this conversation in a grid into the 4 pillars.
Yeah.
And I think, Todd, to your suggestions to sort of lay that out, like as whatever, let's get to what you're articulating, and to Liz, it's sort of different than the flex funds that Liz is describing. But I think we've covered a lot of ground today, and if we could show back up tomorrow, but Pat, I don't know how much time you've allotted, but if we could look at these, just pick up tomorrow in the 4 pillars, I think we could move it closer to the finish line. And we are going to have to do some research. We are going to need to learn from what's happening, where's money being appropriated and the funding that's available. But I think if we could show up tomorrow with some type of a simple grid that we can project and sort of just eyeball it, might be a good idea.
So maybe just to wrap this conversation up so that we might have recommendations for all 4 pillars. Do we want to have something in like the 50,000 for each recovery center, not to be decided where it goes or how it goes until after they've been awarded, or you want to not make that recommendation?
No, I feel uncomfortable. If the recommendation is to wait, I feel uncomfortable to make that recommendation because I don't want the recovery community centers to think they're getting the money and then us to be like, no, never mind, just kidding. So I would remove my motion if we're just gonna wait until we know.
And I'm stuck at, I don't think, Kim, we're ready for that. I think we have to, if Pat, Madam Chair, thinks it's okay, I think we have to sort of continue deliberating some of this tomorrow.
But-
I think some we have
But
harder,
can
we
we-
have,
So you
I
have
think-
recommendations for the first three pillars then, so you'll make your recommendations for those three. And then we'll have discussion on, maybe we'll start the discussion tomorrow on the recovery
that would be great.
pillar. And then there is still potentially money in some of the other buckets that we haven't decided on, that we can either discuss if there's time tomorrow or can bring back to this committee at a different time. Does that make
Before we leave, could someone just reflect back to me what we think the priorities are for those three pillars, just so I make sure we're all clear?
So I think what we have is flexible funding for all the SSP sites. And we said, what did we say for the dollar amount for that? We've talked about different dollar amounts
150,000 for all 17.
for 2 years though, wasn't
2
it?
years.
2 years.
Right. Okay, so there's that. And then also, I think you wanted to add to that one new SSP site where there isn't any. Is that correct?
Yep.
That's what I have in my note. And then there's 2 detox units for a total of 3 million. One in Androscoggin County and one in a rural regional area, which we didn't really decide on, but that can either be discussed tomorrow or you could put it out that way as just a rural regional area.
I
And
think we're gonna
then-
float Franklin. Just to be clear, I think that's where we decided we'd float Franklin tomorrow.
And then the last one is is prevention. And let me pull up this. It's gonna be hard for me to find it now. It's not in my way. So for prevention, it was tell me the dollar amounts, Liz. It was for the money for the flexible funding for families to the
Yes.
CAP agencies for 1.5.
The flexible funding was 700,000, but if we're 700,000 and then the youth serving organization was 1.5.
Okay, backwards. And the youth serving organizations was 1.5.
But both of
then-
those would be for 2 years. So it's
Total for 2 years or each year?
each year for 2 years.
Each year for 2 years. And then then also the recommendation to use the PTTC to
Yes.
facilitate a discussion. And that bar is still on the table, but it's going to be discussed either with the school funding or with the prevention, or maybe both. So that's what we've got to so far.
So I think to your suggestion, Kim, if we can pick up with recovery tomorrow. And
Yeah,
then
so
sort
that
of-
you
and then-
you give your recommendations to the larger group tomorrow, and that we start we said we didn't get to recovery and we want to have that, or we didn't, it's not we didn't get to it, we didn't finish the discussion, and that we want to have that start the larger group discussion with recovery.
If I can make a suggestion, I think you should show the group the ones you did decide on first.
Yes, I
We can
agree.
do that,
Then,
Pat.
and then the recovery, because they
Yeah.
can see how you're thinking, how we're thinking and how that's going. And then do the open discussion about the recovery pillar.
And you
wanted
want to do a
mention-
vote on the things that you guys recommend, right? You might want to just have a vote. I mean, I don't know if that's part of the process that is required, but you might want to do that on those 3 things that seem easy to, at least at this point.
Here in this meeting?
No, I mean at the next tomorrow.
Oh, okay.
Yes, yes. I wanted to make one comment on the recovery thing, because there is one piece of that we talked about, we didn't focus on it, that's really a kind of easy, I think, and that is that we have this one county that doesn't have, one county doesn't have a recovery community center. So I'm going to propose tomorrow that we, Courtney mentioned 200,000, it probably ought to be at least $250,000, just so that they can get that started, because actually there's a group of people working on it, and they need to buy a building that's for sale. And that would take care of Piscataquis. And I think it's quite easy to do that. And it's one-time money, because eventually they'll get into the cohort of the other 222 community centers. But I'd love to be able to do that. And it gives us one clean thing on recovery that's not using up a lot of the money.
I agree
is
with
that-
Gordon, and I think we should put that in our recommendations for tomorrow.
I love
Okay.
it.
Yeah,
Yeah.
I agree with that, but I also, I'm hoping that we can carry forward this kind of spirit of, in this category, of having some of the funding from here be spread statewide. That's kind of been the theme of things with Courtney and with Todd and with others, that we make sure that we convey to the rest of the committee that we really would hope that the funding coming out of this pillar would have statewide spread, truly statewide spread.
Definitely. I agree.
So do we have a package?
I think
I
we're
think-
close to a package, Courtney.
It's a package.
That's really phenomenal.
It's
Great work,
lovely.
everybody.
So on that
Maybe you
note,
won't-
I think
maybe
we're,
you won't make a liar out of me. I told the reporter that we'd have some definite decisions by December. And as we got closer and closer to December, I thought, what was I thinking? Maybe
Good
This is
you
a
job.
won't
package
make
I
me
am super
not
excited
be a
to vote
liar.
yes on, so great.
yeah, good job, Pat. You're good. You were right on. We're right on schedule, we
I
hope.
was pulling that out of a hat.
Pat, when did you say December?
I said it in August.
That's impressive.
Good job.
Oh,
Well, I think this was really great. A lot of great work today. Good thinking the last two meetings. So go team. So I think we're good to go for tomorrow. If Pat, as long as we have time to sort of continue the
Yeah, your meeting
conversation.
starts actually early tomorrow. So it's at
Yeah.
1:30. So, and again, I think there's enough time for this discussion. I mean, Kim's got a little piece of it. I know that Mary's got a little piece. The thing on the budget should be small. So we should be golden.
Perfect.
Yeah, and Pat, I'm sort of thinking after this conversation, maybe we do the budget recommendation and then this committee's recommendations. And then maybe we just launch into the conversation. Maybe I don't do any presentation anyway, because all I was going to do is go over this stuff that we've gone over here today. So
Okay. Okay.
and
And if
are
the
we gonna have
discussion
to have
leads
more
to it,
conversation now that we've decided on a recovery priority for this second?
I can order the discussion in any order people want me to do it, because we'll have, there's still other things that you have prioritized.
I guess I'm
I
just
think
saying it would be great to just like focus on this and get it done, and then we can figure out all the other stuff later.
Yeah. So
We'll
why
see
don't
how
we
it
do
goes.
that? We'll focus on this and then we'll, whatever time's left. I mean, you guys
That'd
have
be
a
great.
list, right?
Yeah, and
So
I
whatever
really like
comes
the
up-
order. I really like the order that you did it in, you know, the harm reduction, the detox.
Yep.
The da.
Yeah, if we get this out tomorrow, we have done good work and we should all go home.
Exactly.
All right, so we'll put together a spreadsheet or something that lists what you've just recommended without all the other stuff.
Perfect. And the
Excellent.
meeting is starting at 1:30, right, Pat? Which is ahead a little bit. So 1:30, everyone, 1:30 to 4:30.
Yep.
Great. Okay, well, thank you very much, everyone. Very lively, active
Wow.
conversation.
See y'all tomorrow.
See you
Thank
tomorrow.
you.
Bye-bye.
Bye.